Hi, everyone, and welcome to another edition of PPI's Wellness Wednesdays. If you missed our previous Wellness Wednesdays, make sure to check out at NJ Preterm on Instagram or any of our social media platforms. Each Wednesday at 12 p.m., you'll be hearing from myself, Christine Ivery, or my colleague, Casey Mile. And it will be a video pertaining to reproductive health, chronic disease prevention, or tips that just overall help to have that positive birth outcome. So before we get started today with our guest, Crystal Sibley Charley, we just want to quickly do an introduction. So as I said before, my name is Christine Ivery, and I'm a health educator for the Prematurity Prevention Initiative. PPI is a collaborative cross-sectional effort that focuses on reducing the number of babies born too soon in New Jersey. And I'm going to just hand it right over to Crystal. I'm really excited that you are here with us today. But we want to say welcome, Crystal, and thank you for being a part of our Wellness Wednesday this week. Can you introduce yourself and share a little bit about Melanin and Motherhood?
Thank you, Christine. It is really a pleasure to join you today. Very excited to be here. Melanin and Motherhood is literally my second baby, even though it literally was born just before my actual daughter. Melanin and Motherhood began as a blog and a diary to my unborn daughter that was, a very tremendous or tumultuous pregnancy for me. And, since that time, it has evolved into an advocacy organization, and most recently added to our ways we advocate for healthy birthing spaces. We now have added doula services through myself, as I recently became a certified doula through SMC Full Circle Doula Companion, Doula Birth Companion Program. So, our focus is we center Black mothers and Black maternal health outcomes. And, we do our part to help eradicate the disparities that exist in Black maternal health.
Thank you for sharing that. Really great intro.
Absolutely.
And I'm thinking for women that aren't familiar, or even families that aren't familiar with doulas, can you share some light on what is a doula and why are doulas so important for pregnancy?
So doulas are labor and birth companions, birth coaches, sometimes we're considered, but we provide emotional, psychological, physical, comfort measures during, your prenatal time, labor and delivery, and there's also postpartum support from doulas. We also are very instrumental in helping with breastfeeding, getting moms started on breastfeeding after giving birth. Some doulas are actual lactation, certified consultants. But a lot of us basically have the basic knowledge of education to get a mom's breastfeeding up and running, so to speak. We sometimes we're confused with midwives. We don't literally, as they say, catch the babies. Our focus is on the moms. We are not medical, and we don't substitute your medical professional like a midwife or an obstetrician. But we are there solely, really primarily for the comfort of the mother, and helping her to have her body do what we know it naturally can do, which is, give birth, labor, and literally deliver the child. We are strategic in the birth space where, when you have a doula present, unnecessary medical interventions reduce significantly, such as unnecessary cesareans, epidurals, and things of that nature. So, which are also very critical when we look at the overall Black maternal health disparities and certainly Black maternal health outcomes. So doulas play a very important role in the reduction of interventions that ultimately sometimes lead to mortality, and those very close near misses that we often talk about.
Absolutely. Thank you for shedding light on that.
Yes.
And Crystal, I'm thinking to your last point that with a doula present throughout that experience, going through early birth can also be prevented that way too, with a doula being on that birth team. So it's really
Absolutely.
Yeah.
Yeah, when we speak about prematurity in New Jersey, as we know, we have an uphill climb in that area as well. And when I speak about Black maternal health outcomes, I certainly am including premature birth, I gave birth to a premature baby at 35 weeks and 5 days, a 4-pound, 1 ounce baby girl. And, for a Black maternal or Black infant mortality is extremely high, and, in New Jersey. And again, that has everything to do with, or a lot to do with, the care that mom is getting or not getting in all of the birthing spaces. And I don't refer to birthing spaces literally as labor and delivery. I'm talking about your prenatal care and the time going up to that. And that postpartum period is also very critical too for both mom and baby, literally up to that first year after giving birth.
Thank you for mentioning that, because sometimes we think, moms go home and she's, just fine and everything. And there's so many different warning signs to think about. And actually, Casey and I discussed it on our last Wellness Wednesday, like a headache or blurred vision or different things like that that can lead right into preeclampsia. And there's so many other things that women have to think about when they do go home.
Absolutely.
Yeah.
And even if you have preeclampsia before you give birth, you still have to be very mindful of the signs and symptoms postpartum as well. I'm a preeclampsia survivor, and I can tell you right now, things can change in a matter of a blink of an eye when it comes to, preeclampsia and all the emergent, issues that are associated with it that can be absolutely fatal, or also just, long lasting, have very long lasting effects.
Absolutely. Thank you for sharing. And
Yeah.
I was thinking earlier back to when you mentioned advocacy and how you've definitely played a big role in with Melanin and Motherhood, and then also in your role as a doula, as being an advocate for mothers. So I wanted to ask you, for Black moms specifically, what type of stigmas or disparities or biases do Black moms in New Jersey face? And what do you think is being done to help counteract or to address these things?
Well, one thing you have to be so careful about. I'm somebody who's a very big stickler for language, right? Language absolutely matters, and interpretation matters, right? So when you look at the numbers of disparities, you'll start to hear in your head, Black women have the highest mortality rates. Black women have the highest morbidity rates. Black women give birth prematurity at the highest. And you start to think that it's because if you're Black, your Blackness itself is the risk factor, but it's really not the risk factor. What Black women are up against in birthing spaces, and again, when I say birthing spaces, I'm talking about prenatal care through postpartum care. Um, it's racism. It's not being of the Black race, right? It's racism, and so you start to see inequities and in treatment, right? There is a pervasive um, history of lack of acknowledgement of Black women's concerns. I saw a quote on social media that I thought was just really can sum this up, and I'll still break it down. But it says, physicians can be to Black women like the police are to Black men, right?
Mhm.
And so, like, when you think about, what that encompasses, right? That's just definitely not, as a very dangerous space for us. And the thing about what we're up against is that it's not relegated to socioeconomic status, right? It's not relegated to those of lower education levels. You know, in fact, the higher you are in those areas, whether you have the higher socioeconomic status, you have higher degrees or more advanced degrees, your maternal outcomes are actually worse, right? So it's not something that is based on those things alone. Those things are also factors, but when you start looking at the totality of the entire picture, right, you're looking at social determinants of health. And if you take it all the way back to the inequities and the inequalities in healthcare, in and of itself, all that plays a very critical role in what we're up against in maternal health spaces. Um, so when you look at like the morbidity, the near misses, things like stress, right? Um, that can play in a really critical role in how your body responds to your maternal status, right? Um, And there are studies out there, and there's starting to be acknowledgments in the medical world about the fact that there's really just Black women have a very unique life, like a unique walk in life that is unparalleled. And it comes with stigma, it comes with stress, it comes with being born into, inequality, with respect to the social determinants of health. Those are the things that we're really fighting up against. The other thing is, when you look at like westernized medicine, and not all westernized medicine is horrible, but you have to look at some of the critical thinking that goes into that westernized medicine practice, right? And you have doctors who have been taught things like, Black people have a much higher tolerance of pain. And so if a Black woman says she's in pain, she's really not in that much pain. And so they ignore the symptoms. Just simply being unheard, being dismissed, not being validated, right? When we say that I don't feel right, not really responding as you would to our white counterparts, that really plays a huge role in what we're up against. And so what's really critical to know is that about 60% of Black maternal mortality deaths are avoidable. And they were avoidable for those very reasons that I just named. It's usually because someone didn't listen, someone didn't respect the voice of the Black person birthing. And so we have to really start to see in New Jersey. I know that there's the Nurture New Jersey initiative by Tammy Murphy, First Lady Tammy Murphy. And the Nurture New Jersey just released a strategic plan a few months ago. And there's a lot of good stuff in, because over the past 25 years, the Black maternal health numbers in New Jersey have absolutely gone in the wrong direction. And just really since about 2 years ago, it went from a Black woman being 4 times as likely to die in the state of New Jersey to, I believe it's 7 times more likely to die. So we're definitely going in the wrong direction despite all these efforts. So we have to make sure that when we have things like Nurture New Jersey strategic plan, one, we are supporting the strategic plan, we're doing what we can to bolster the plan, and what's paramount, we do what we can to make sure that the changes and the things that are going to come out of that are sustained. And I think that one of the key ways to do that is through legislation, something that's harder to undo.
Yeah, you just dropped so many gems right there. And I'm like, I want to address this and that, but I think one thing that stands out for me amongst what you just said is thinking back to when you were talking about the stress and how Black women have this different type of story and can live so many years and be silenced or unheard or just all these different things. And like you just mentioned, that every woman needs a voice and has a voice actually. So
Yes.
thank you for highlighting that. That really stands out. But everything that you said, of course, did. I want to talk about something that's kind of aligned with our last points that you were contributing, and thinking about the word community and what that means to you. So for this question, thinking about how does being a part of a community contribute to Black maternal health, and what benefits does it have?
Oh gosh, that's a great question. So, I'm huge on community. Before I got into Black maternal health, I've been a civil rights activist for many, many years, like 10 plus years now. And one of the reasons why I'm such a big, I support community led efforts is because, one, it empowers the people who are going through, right? And being in a community is like, and making sure that it's a community approach, it truly is empowering, but it also level sets with those who are in positions to make change, right? You have a community led effort, whether it's Black maternal health, whether it's police reform, housing, healthcare, it puts you back in control, right? And it should remind each and every one of us that those who we are requesting these changes of, at the end of the day, they are things either siloed, right? One, you're just always stronger, unified, right? And I believe in silos to perfect your individual craft. But I think when you want to make change, right, radical change, you have to come out of those silos, right, and build a coalition, using all your different talents, all of your different areas of expertise to make it like the strongest fight ever. So I don't want to say, when I say silos is always a completely negative thing, but there's a space for it, right? But when it comes down to community, you can't hold that to yourself. You shouldn't covet your expertise. You shouldn't covet your knowledge, in a way that doesn't help drive the narrative in the right direction. So, that's really how I feel on community and where I stand on that matter. But I really think that, not to give a lecture in civics, but when it comes to community, civics is really, really important. So I think that community involvement, by educating the community, whether on whatever the topic is, but today we're here for Black maternal health, right? We're here for maternal health. So educating the community on maternal health, giving them the tools to mobilize, to make a stand, right? Making sure that we're offering community-based services, for us, by us, people that look like us. All of that is really empowering. All of that is strategic to moving things in the right direction, for Black maternal health. So, that's where I stand on community.
Yeah. And what I'm hearing also, I know you said the for us, by us, and I'm also thinking of like the nothing about us without us too,
There it is.
that stronger together type of impact type of movement.
Yes,
Yeah, thank you. Thank you for putting that to the page also. So
absolutely.
I think we're at the point where we're going to wrap it up, but I want to know if people are trying to find you out there, they want to know about Melanin and Motherhood, about your services, about anything. How can they find you, and what should the people know?
So if you're looking for Melanin and Motherhood, we are on Facebook and Instagram and Twitter. My website is www.melaninandmotherhoodnj.org. And, our Instagram is Melanin and Motherhood, and our Facebook is actually Melanin and Motherhood Doula Services on Facebook. And, listen, if you're looking for a doula, a Black doula, there's plenty of places you can make the call. I definitely want to give a big up to the Birth Center of New Jersey, because they are the only Black-owned birth center in the state of New Jersey. They're in Union, New Jersey. They have a tremendous group of doulas there. Their doula coordinators, Michelle Gabriel Caldwell, who is a tremendous, not only doula, but childbirth educator, advocate, mother empower, right? And that's like that's one other space, because I'm based out of Burlington County. So if you're in the northern New Jersey area, I always big up the Birth Center, New Jersey. Depending on your socioeconomic status, there are different, and some places aren't based on your socioeconomic status. I believe Mercer County is not. There are different types of community doulas that are out there, so you can always Google community doulas. I don't remember the name of their the Mercer County group, but you have community doulas of South Jersey. So there are ways to get doula services that are no cost to you based on your socioeconomic status. And also, I know that with doula services not often being covered by private insurance, nothing that we usually suggest, if you still want a doula, one, when you find one of interest, some offer sliding scale rates. And I've also seen moms be really creative by putting their doula services on their registry to get help with subsidizing the cost. So, don't feel like, oh my gosh, you look up a doula and you see her rates and you think it's like tag or cost for services you think are, out of your price range. I would still say reach out, see what you can do. When you reach out for any doula, interview your doula, think about the things that matter to you, right? Every doula may not be your perfect fit, and it may not be based on the number alone, right? So, if you're on social media and you're looking for me as a doula, I've given you my handles. But if you're looking for a doula in general, right, I would just say you can Google us, really, like Google doulas in whatever part of New Jersey you're in. It'll come up because most of us have our own websites and our locations are there. Also, you can always do what a lot of people do now. You put the call out on social media. Hey, I'm looking for a Black doula in, Camden County, Essex County. They have sister to sister doulas up there. And you will get a list, because believe it or not, we're really out here. There's a lot of us, and it's growing. Black birth work is growing because we are all trying to eradicate these disparities.
That's right. Have those positive birth outcomes and
Yes,
everything positive after birth too. So I
absolutely.
appreciate that. No, I know that you all are out here, and I feel like you got us covered. I feel like you have our back. So
Absolutely. Thank you. And we appreciate the work you guys do, because the prematurity piece is really critical. Like, our little babies are dying, and we don't need them to be, and they don't have to be. And as I always say when I speak on this, like, we talk about data, but in this case, data are moms and babies, and we need to save them all. So, organizations like yours, Christine, are so critical to this whole process to eradicate disparities in Black maternal health. So thank you again for having me.
Thank you. That's our goal. That's what exactly, you hit it right on the point of what we want. And we're so happy for the Prematurity Prevention Initiative that you joined us today. So Crystal, we're closing out, and I thank you so much for sharing the resources. If you missed it, you can just check it. Everyone, in the caption, we'll put all of her handles and all the website information there. But thank you so much, Crystal, for joining us, and we'll see you next week for another PPI Wellness Wednesday. Until next time, bye-bye.
Peace and blessings.